Good morning and good afternoon and welcome. Thank you all for joining this joint webinar with the Commission on Massage Therapy Accreditation, or COMTA, and the Academic Collaborative for Integrative Health, or ACIH. My name is Alyssa Wustrel and I'm the Executive Director with ACIH. This is the second joint webinar we've done with COMTA, and this subject of are you safe and competent to practice has really struck a chord as we have a large group here today. We have some wonderful panelists representing both organizations to address the topic from multiple angles, including Don Hogue, Executive Director of COMTA, Cliff Corn, Chair of COMTA, Dale Healy, Commissioner with COMTA and Vice Chair of ACIH, as well as Dean, College of Health and Wellness, Northwestern Health Sciences University, and Stan Dawson, Board Member and Treasurer of ACIH and President of the Alliance for Massage Therapy Education. A few housekeeping matters. We do have a large group, as I said, so all attendees are on mute. And if you have a comment or question, please use the question box to send it in. We will have a Q&A after the presentation. And we're looking forward to that more interactive part of the webinar. So please go ahead and send in a question at any time and it will be addressed later. Some takeaways you can expect from this webinar, as you see on the screen, are of course focused on competencies and competency-based standards. COMTA, as a comprehensive resource for the massage bodywork profession, will be covered by Don Hogue and Cliff Corn, who are our first speakers, and hospital-based massage competencies will be reviewed, as well as ACIH resources regarding competencies. And I'll be sharing some information about a new initiative regarding comprehensive integrated pain management that we've been involved with. And now I'd like to turn it over to Don Hogue, Executive Director with ACIH, with COMTA.
That's you.
Yes, hello. Thanks, Don.
Yes, thank you so much, Alyssa, for that warm welcome and introduction. And thank you to everyone who's joining us today and who will join us when you play this back in the future. It is my pleasure to share this time with my colleagues and present on behalf of COMTA. As Alyssa said, I have the pleasure to serve as the Executive Director for the Commission on Massage Therapy Accreditation. And one of the main things I want you to take away about COMTA from this presentation is that we are the only agency, accrediting agency, that's recognized as specialized. And so really we consider ourselves to be of, by, and for the massage therapy profession and massage therapists. We also serve the aesthetics community as well. That is a theme, that specialized recognition, that I'm going to reinforce over and over again in the beginning of this presentation. And I'm probably going to move through the first few slides pretty quickly so that I can really focus on the slides toward the end that relate to our curriculum competencies. So the COMTA mission and vision, of course, our mission is broad to uphold and elevate the standards of excellence in massage therapy, bodywork, and aesthetics education through our specialized recognition as an accrediting agency. And our vision is that all quality massage therapy, bodywork, and aesthetics institutions and programs are accredited by COMTA. Yes, that is a bold vision, that all quality programs and schools are accredited by COMTA. We're actively pursuing that every day, and again, reinforcing the fact that it's that specialized, expert-based recognition that COMTA brings to our work. That what that does in terms of consistency of educational standards really reinforces outcomes that the public can depend on when they are going to see a massage therapist, a bodywork practitioner. As a regulatory agency, and those of you that are involved in regulatory work, you understand that the public protection is the #1 priority with our work and as an agency, protecting the public. And I'm just going to digress for a moment on that theme right there, because I also have the pleasure to serve as a member of the Virginia Massage Therapy Board. And as part of that, one of obviously, our main tenets is the protection of the public. And one of our main functions is to participate in disciplinary actions, disciplinary hearings, formal and informal conferences, and typically as the massage therapy board member, I am there with my colleagues and peers from the nursing profession. And I was in Richmond, our state capital, a few months ago, and we had several cases, a pretty full load this one day. And the chair, who is a very experienced woman with a nursing background, when we were deliberating our decisions, she kept bringing forward this question and bringing it back to, are they safe and competent to practice? You know, taking aside all of the, you know, stories and things and descriptions and whatnot, you know, that pertain to those particular cases, it was, are they safe and competent to practice? And if so, or if not, on what are you basing that? How do you know? And so as Alyssa and I were talking about the subject of competencies, and I know that Dale and Cliff and Stan and I live in this world of competency-based education, it just really seemed like an appropriate title for our webinar. Again, looking through this lens of competency, and how do we know that we are safe and competent to practice? So my next slide is just a picture of the COMTA staff and commissioners to introduce you to us. Although some of the faces have changed on this picture, our roles, our twin engine roles remain the same. The staff, we're responsible for the day-to-day operations, the customer service to our schools, compliance with our recognition. And the commissioners really serve as our accreditation decision-making body. They're integral in our community outreach, and they bring a specialized expertise to that decision-making and to our strategic planning, really to all of our work. As an accrediting agency, we offer two types of accreditation, institutional and programmatic. Institutional is for a standalone massage therapy school, again, something that would cover the full operation of that school. Whereas programmatic, you find more in like a community college environment where the program would be accredited by COMTA within the larger institutional accreditation of the college. Regardless of that status of accreditation, we bring that specialized recognition to both respects, the programmatic and the institutional. And again, that's for massage, bodywork, and aesthetics and skincare. One of the very unique things to COMTA is our curriculum competencies, and you will see those in an example of the chart in just a few slides. And again, reiterating that we have practitioners, educators, and other experts in our field as part of our decision-making body. We offer one other type of recognition along with accreditation, COMTA endorsed curriculum. And we recognize that in the vocational school landscape that many of our schools have a range or do not actually have a range of resources. Some just might not be at a point where they can pursue accreditation. Some maybe want to pursue it, but they need to take a step to get there. Endorsed curriculum meets both of those needs. And as you can see by that first bullet point on the slide, the consistent application of curriculum competencies. That is consistent between our accreditation recognition as well as endorsed curriculum recognition. And that does go hand in hand with the faculty qualifications. And Stan will speak to you a bit about that during his slide. So let's take a look at these COMTA curriculum competencies. And you're going to hear from Dale and Alyssa a bit on the, application to practice in terms of competencies. And Cliff and I are really going to share more about the application from the education and training side. And again, these competencies, really serve, they really get to the heart of our specialized status. And as you see there on the slides, it's about evaluating a program in terms of the student competency really focuses on the student learning as opposed to how much time is spent on a particular topic. We do not, within our competencies, require a specific amount of time devoted to any content area. That's where a school gets to utilize their creativity in determining how much time gets spent on what areas. We do require, though, that they include all of these 6 general competency areas in their curriculum somewhere in their design. And there are more detailed levels to these 6 general areas. But again, within the specifics and the generals, the schools get to determine how they demonstrate these competencies rather than being prescribed in how they do that. So you can see from these 6 general areas that they all relate to professional practice. They all relate to the safe, competent, ethical practice of massage therapists, as well as their self-care. On the next slide, we have a sample of what the competency chart looks like. The full chart will be available to you as a handout. And so I just wanted to include a short excerpt here for the visual enhancement of understanding how the chart works. So it's pre-populated with the for example, the effects of touch, massage, and bodywork techniques. That is the area of content that is required. It's pre-populated on the chart. Same with element 2.3, equipment and supplies. And then we have some description about what is expected to be demonstrated by a student or demonstrated or able to be shown as mastered, comprehended. They can do that through practical exams, written exams. And again, if you look at the 2 columns on the far right-hand side, that's what the school completes. They show us where in their curriculum do they teach this topic and where do they assess it or test it. And it's very natural that schools teach these topics, they layer it all through their curriculum. But with this chart, we want them to focus on where is it really condensed, and again, where is the focus for the teaching and where is it tied to the assessment. One other nice feature of our competency chart is that it's aligned with the ELab. That is the entry-level analysis project. That is another guideline that's been created from the work of the stakeholder organizations in the massage therapy field. Again, the entry-level analysis project serves as a guideline for entry-level massage education. Within the ELab, there are some suggestions for amount of time to be allocated for certain content areas. Because COMTA does not do that with our competencies, we have instead aligned our competencies with the ELab outcomes so that our schools can be assured that their students are meeting the outcomes for that entry-level education as well as the standards for the profession. Finally, one of my parting notes is that I really want everyone to think of COMTA as a resource for our profession. Again, we're an accrediting agency, we're a regulatory body, but we serve our community in any way we can, much like all of you do, just like ACIH does. We serve our state boards, we serve our schools, educators, students, our member organizations, and of course the public. And you know, we're really focused on service and support. And so if we can be a resource to you, please don't hesitate to reach out to us at any time. We have benefited from some financial support from our 2 member organizations, or 2 of our larger organizations, the AMTA and the ABMP, and they have pledged their financial support to assist schools in applying for accreditation and endorsed curriculum. And really, you know, that is their way of reflecting their alignment with the value that accreditation holds in our professional community, the value that an accredited education that's recognized as specialized, that meets the standards of our profession, how that ensures that our practitioners are safe and competent to practice. We thank AMTA and ABMP, and Stan, who will be speaking next, I know they too are making great efforts and strides with lots of support to encourage educators also to pursue these same standards based on competencies. So Stan, it's my pleasure to pass the baton to you and share with the audience about this exciting TESP.
Great. Thanks, Dawn. Good job. I'm Stan, and I'm going to talk to you about 2 main subjects, the National Teacher Education Standards Project, which is on the slide, and then phase 1, the competencies for massage therapy teachers. when we started the Alliance for Massage Therapy Education, we surveyed our members and asked them basically what they thought we should work on as a goal, as a group. And the main thing was just to improve the standard of massage education. It was determined that the best way to do that was to create a project where we could teach teachers be not just content experts, but to also have expertise in education, philosophy, and basically how to teach, combining sort of the content expertise of a college professor with the educational background of a high school teacher. Best of both. Most schools do not require their teachers to have a lot of educational background. They mostly focus on hiring people with content expertise and gradually try to train their teachers and expand their knowledge of how to teach in their faculty development programs. And COMTA encourages that in their standards. They ask each school to develop a plan for faculty development. So in 2013, we published in January the core competencies for massage therapy teachers, and this is the first phase of NTEST. The competencies themselves are divided into 4 categories and 10 standards. The 10 standards are related to learner and learning, content, instructional practice, and professional responsibility. So there's 2 or 3 competencies in each of the categories and a total of 10 standards altogether. When we started the whole project, we envisioned 5 phases, which are on the slide there. The first phase was the development of the competencies. In the process of seeing how this can be most useful to people, though, we also realized that if we could give people an assessment guide so that they could assess their own competence as instructors, then they can kind of gauge where they are in their own development as an instructor and their knowledge of educational philosophy and principles. So we recently hired a project manager who is working on revising the current assessment guide, and we will probably early next year have an updated assessment guide so that people can look at their can assess themselves and how they're functioning as an instructor and see where their areas of weakness are and plot their own improvement plan. After the assessment guide was developed, we also went on to our second phase, which was a result of a committee called the Teacher Resource Development Committee. And on our website, there's a database of teacher resources, and that is under revision as well. That was the second phase, so that teachers who either are already teaching or who want to develop a program to train teachers have a set of resources that help them deal with issues that they're concerned about in their careers as instructors or as trainers of teachers. So this was the second phase, and that was completed on about 2014 or 15. More recently, we developed in phase 3 a model teacher training curriculum. And this is a curriculum that's basically is intellectual property of the Alliance, but it's going to be open sourced so that anyone who wants to develop a teacher training program can consult the curriculum model and help them in the design of their teacher training program so that they're certain to cover all of the competencies so that their graduates are fully prepared to pass when they apply for a teacher, certified education for therapeutic massage and bodywork, our CETMB program, their graduates will be fully prepared to qualify in our assessment of instructors. So the model curriculum is going to be used, anyone can use it. We just will like people to mention that it was developed, the curriculum was based on the Alliance's model curriculum, and there'll be some restrictions, but basically it'll be an open source intellectual resource. The fourth phase of our NTESP project is the CETMB program, Certified Educator for Therapeutic Massage and Bodywork. And in this, we're finally reaching the fruit of the whole project, which is certifying teachers as not just content experts, but knowing how to teach. There will be a portfolio review as the basis for assessing those who apply for this certificate. We have portfolio reviewers in place who are trained to evaluate the portfolios of people who already have some teaching experience. And in the future, folks who want to be a certified educator but are not experienced teachers can do teacher training with whoever they care to, and then apply for the portfolio review process and become certified. In the final phase of this project, people were basically asking the profession as a whole to support the model of improving quality of massage education by encouraging the industry to adopt these standards and the teacher certification program into their state laws or into their accreditation standards, into NCB and FSMTB CE provider approval projects. And that is, so right now it's going to be a voluntary program, and eventually it could become more mandatory in certain segments of the profession, and that's my story. So I think it's time for this guy who's reclined on the couch here, Cliff Korn, on the next slide to take over. Cliff, you're up.
Thank you, Stan. Appreciate it. And hi, everyone. This is Cliff Korn, and I do have the honor and privilege of chairing the Commission on Massage Therapy Accreditation. And I absolutely loved the topic that we're talking about today. You know, are you safe and competent to practice? In my time in this profession, almost all of it has been as a practitioner, as opposed to an educator or administrator. And so this really hit me. But as a school owner, administrator, or educator, how do you know that you're appropriately preparing people to become safe and competent practitioners? How do you know? As a practitioner, how do you know you're practicing safely and competently? Now, these are indeed the goals and the embodiment of our missions, but how do we really know? And anybody who's met me in the past knows that I beat a solitary drum pretty frequently, and that's the value of ubiquitous accreditation in the education world. But even that doesn't necessarily mean that people are practicing safely and competently. We know the education would be good if there were ubiquitous accreditation. But to me, the real answer is specialty accreditation. which Dawn already talked about a little bit, the value of specialty accreditation. But to me, to be competent to practice, that's all about competencies. The words go together really well. So schools that are accredited by specialty accreditors have their curriculum designed around profession-specific competencies. And that's one of the things that can make you safe and competent. And in the massage, bodywork, and aesthetics world, that pretty much means COMTA alone, because we're the only, as Dawn mentioned, the only accrediting body that's recognized as a specialty accreditor within those fields, and that's by the USDE. So COMTA competencies then, to me, are the answer to a lot of this. And Dawn talked about the general topics, but the nice thing is they get specific, which is really what talks about safety and competence. And just listing some of the competencies, they include structure and function of the human body, the effects of massage techniques, terminology, assessment and data collection, clinical reasoning and treatment planning, management of the client session, safe and effective use of equipment and supplies, self-assessment and self-care, communication in the client-therapist relationship, professional boundaries, professional ethics, business practices, marketing, professional referrals, professional relationships, continuing education and research literacy. So schools that are COMTA accredited have actual peer review to determine not only where these competencies are taught in their curriculum, but further, how mastery of them is assessed. So to my way of thinking, specialty accreditation goes a long way in answering the "are you safe and competent to practice" question. So I hope that's been helpful for this webinar, because that's really what I think sets us apart and can set up everyone in the profession. So I'd like to turn this over now to Dale, and take it away.
All right, thanks, Cliff. Hi, everybody. My name's Dale Healy, and I'm pleased to be participating in this webinar today, and just want to thank the other panelists and contributors so far, and also for those attending and listening in today, because this is an important topic. Like Cliff and others have mentioned, competence, this concept of competencies is something that I'm very passionate about. There's, oftentimes, just a comment on this before I get into my specific topic, oftentimes in education, there are references to time as the measurement of quality, or the measurement of depth, or a measurement of, what the standard is. We talk about 500 hours of education versus 800 hours of education, or even in more traditional educational settings, associate degrees, bachelor's degrees have that idea of time or a number of credits attached to them. But what really matters, I think we can all agree, is competence. There are, not all 500 hours of education programs are equal, and that's why this concept of competencies is so critical, and where COMTA and other programs, specialty accreditors that look into that and really understand what students are being taught, and ideally what they know and are able to do as a result of going through an educational program is what's really important. So with that, I'm pleased to be able to share a little bit about a specific example of a project around competencies. And this is, I guess, my intent, my hope is that this will help illustrate the importance of competencies in a specific environment. So Stan talked a little bit about competencies, specific competencies as they relate to teachers, instructors in massage therapy education. I want to talk about, from a clinical perspective, competencies related to a very specific environment, clinical environment, that being the hospital. So hospital-based massage therapy competencies. And by the way, I'll say this on the outset too. This is a project that was launched with the support of ACIH, the Academic Collaborative for Integrative Health, which you're going to hear more about from Alyssa, the executive director of that organization, in a minute. But I want to recognize the task force members you see on your screen. There's myself, some of you may know MK Brennan, Carolyn Tagg, and then Beth Rosenthal, also a participant in the project and a staff. She provided staff support from the collaborative as well. So we can go to the next slide there, Alyssa, and I want to just to sort of introduce this topic. Why hospital-based massage therapy? Why is this an important topic to talk about competencies around? So these outcomes that we see in the hospital, reducing pain, reducing anxiety, promoting sleep, reducing stress, decreasing nausea, and lowering blood pressure. Those of you that are massage therapists on the call know these outcomes very well, right? And those of you that are familiar with the hospital environment probably realize that these are very important outcomes that we look for with patients. If a massage therapist can influence these outcomes, these patient outcomes in the hospital environment, that would be pretty spectacular. And we know there's a lot of evidence to support the idea that massage therapy does these 6 things, among others. So that's great. We've got hospitals, we've got massage therapists, problem solved, right? We'll just put some massage therapists in the hospital and we'll be good to go. Well, we can't be not quite so fast, right? There are some specific competencies that come into play that are specific to this environment. So, and a lot of these have to do with the unique elements of the hospital environment and the patient population. So we can put some of these up here, Alyssa, if you would. So we've got things like patients' complex medical conditions, psychological stressors for patients and therapists that are common in the hospital culture and environment. I think we can all agree that those of us that have spent time in a hospital as a patient or a visitor realize that being in that hospital culture and environment is very different than being in a massage spa type environment or even in a chiropractor's office practicing as a massage therapist. And then the interprofessional nature of that acute care setting. So we got doctors and nurses and surgeons and other support staff that you've got to work with in the hospital environment. All of these elements of the hospital environment are reasons to have there's sort of justification, I guess we might say, for a set of competencies that could establish or indicate that a therapist is safe and competent to practice in that specific environment. Very few massage programs provide training in these topics. So again, that's sort of laying the groundwork here for this gap between a re-emerging opportunity for massage therapists to make a difference and the education that they're being provided. So we can go to the next slide there and see the conundrum. So again, as I mentioned, there's a need for safe practice of massage therapy in hospitals because patients are experiencing all these challenges that massage therapy can help. However, hospitals are often unaware of appropriate training standards for massage therapists and how to orient and supervise massage therapists. And I've experienced this firsthand with some of the partnerships that my school has had with hospitals. They've come to us and said, we've tried to hire massage therapists, but we don't, the massage therapists don't know how to operate in our environment, and we don't know how to train them. And the schools, oftentimes under number 2, they often lack the content expertise and curriculum to provide appropriate training. Many of the instructors that are teaching in massage therapy schools, have not practiced in hospital environments, and don't have a deep understanding of all of the nuances of practicing in that environment. So it's this gap between what would constitute safe and effective practice in that environment and the missing expertise on both the part of the hospitals and the schools that a set of competencies could help bridge. Now, I want to just step back and say, as the note says at the bottom here, that hospital-based massage therapy, this is an example of an emerging practice environment which exposes gaps between traditional models of education and practice. And as more of these show up, as more settings and models of practice are established, the need for generating those competencies becomes important. So, okay, we can go to the next slide. And so just to give you just a brief summary of where these competencies came from, we don't just pull these out of thin air. And again, this is an example, but could be applied to other areas. It's important to ask the folks that are situated in these settings about what's needed for practice. So the task force that I participated on several years ago distributed a survey to about 37 hospitals that had some form of hospital-based massage therapy program. We got an impressive response rate of 87%, and we're able to generate a list of our current list of hospital-based massage therapy competencies that is basically a combination of survey results, follow-up feedback, and input, or you're combining them with the Academic Collaborative for Integrative Health Competencies for Optimal Practice in Integrative Environments. And this raises another good point, I think, and that is, each, competencies, as we build these things, they can, they relate to each other. So if there is an established set of competencies for, in this case, practice in integrated environments, that could have some relevance for the specific example of massage therapists practicing in that environment. All right, next slide, and I'll wrap it up here. Just as an example, we came up with 3 competency categories. Competency 1 deals with the hospital environment, as I mentioned, some pretty unique elements of that environment that therapists should be aware of. Competency 2 has to do with massage protocols in the hospital environment, things like understanding medical conditions, ability to appropriately adjust massage techniques for patient conditions, understanding indications, contraindications, ability to work around hospital equipment, that sort of thing. And finally, therapeutic presence, be able to demonstrate therapeutic presence within the hospital environment. And this has a lot to do with the unique types of stress and anxiety, pain, grief, trauma that the level of which you're unlikely to see in other practice settings. So again, just to emphasize, this project could be replicated anywhere a disconnect between the current education and practice models and emerging practice environments is identified. So with that, I will go ahead and wrap it up and turn it over to Alyssa to chat with us about the Academic Collaborative for Integrative Health.
That's great. Thank you so much, Dale. I really appreciate it. Thank you to all of our speakers so far. I am back again. My name is Alyssa Wistrel. I'm the ED with ACIH. I'm going to give you a brief commercial on ACIH, who we are, what we do. I know there's a number of you on the line that are familiar with our mission and our vision, but I'm going to go ahead and repeat and then get into some of our history around competencies. So we are a membership organization. Our membership includes 18 core members that are the councils of colleges, accrediting agencies, certification and testing orgs that are associated with the fields of integrative health and medicine that are listed here, right? Acupuncture and oriental medicine, chiropractic, massage therapy, naturopathic medicine, and direct entry midwifery. We also have an emerging and traditional world medicine professions group as a category, and that includes yoga therapy, Ayurveda, homeopathy, somatic movement, and nutrition. It is not exclusive to those particular professions, and it can have more membership, and we also have more membership availability in our individual colleges, universities, and schools, which we currently have 30 of. We have opportunities for associate organizations to join us as well as individuals. And our URL is integrativehealth.org. So the next slide is just simply an alphabet soup of all those core members. I'm not going to go through it, but just so you have the slide. And I am going to read our vision, which is ACIH envisions a healthcare system that is multidisciplinary and enhances competence, mutual respect, and collaboration across all healthcare disciplines. This system will deliver effective care that is patient-centered, focused on health and well-being, and readily accessible to all populations. The mission of ACIH is to enhance health by cultivating partnerships and advancing interprofessional education and collaborative practice. ACIH educates, collaborates, and advocates for the inclusion of the values, practices, and disciplines associated with integrative health, and in particular for collaborative, team-based, patient-centered care. I'm going to zoom through some of my slides so we have time for questions. We do have a CEDR, which is our Clinicians and Educators Desk reference. It's available as a free download on our website and or can be purchased in a soft cover. It's available through EPUB and Kindle formats, and there's a URL to find out more about our desk reference book. It's an excellent resource. And also just a shout out to our working groups, of which we have 3 clinical research and education working groups. Deb Hill, who is on the webinar with us, her email is there. She is managing our working groups along with our longtime director of working groups, Beth Rosenthal. And it's just a rich, rich resource that is available to our members in the community. So do take a look at through the link here at the working group presentations. And HBMT is what Dale Healy was just sharing about as a working group project. There's a lot of material in this part of our site about HBMT that may be of interest. And in addition, we have those competencies attached to this webinar as a handout along with others. So just a little background. Dale mentioned the ACIH competencies, so to speak, and we wanted to give a little bit of background on our involvement in this space, which is that back in 2010, ACIH did create a document called, as Dale had called out, Competencies for Optimal Practices in Integrated Environments. It was a collaboration of academics and practitioners from the 5 disciplines that we represent, which I've already named. At the same time, almost, IPEC, which is the Interprofessional Education Collaborative, published competencies entitled The Core Competencies for Interprofessional Collaborative Practice for 6 disciplines: medicine, nursing, osteopathy, pharmacy, dentistry, and public health. So given that timing, ACIH reviewed the IPEC competencies and adopted them as a board and organization, and added in 2 more that are specific to our disciplines. And you can see more about this in our handouts as well. So IPEC competencies are 4, right? So the general competency statement is all I'm going to read. Basically, I'll read through. Value and ethics for interprofessional practice. Work with individuals of other professions to maintain a culture of mutual respect and shared values. Roles and responsibilities. Use the knowledge of one's own role and those of other professions to appropriately assess and address the healthcare needs of the patients and populations served. 3, interprofessional communication. Communicate with patients, families, communities, and other health professionals in a responsive and responsible manner that supports a team approach to the maintenance of health and the treatment of disease. And the last IPEC competency is about team and teamwork. Apply relationship building values and the principles of team dynamics to perform effectively in different team roles. skip forward here. So we added 2 as an organization. The first one, evidence-informed practice. And you can see all the elements of the expanded elements of these competencies through the handouts. But again, just the general competency statement here for evidence-informed practice: explain, evaluate, and apply scientific evidence in the context of practitioner experience and patient preferences, and apply evidence-informed decision-making in integrated healthcare delivery. And then institutional healthcare culture and practice, to prepare practitioners who were not principally educated in mainstream conventional academic hospital and outpatient delivery environments to work in such settings and systems. So that, when you put it in context, I mean, and also given Dale's comment on HPMT, hospital-based massage therapy, just the bridge, this bridge that we're trying to create from an ACIH perspective between these conventional environments and the environments that we tend to populate in freestanding clinics, or maybe we're moving into some of these other healthcare delivery environments in which we need to have more of a grounding around how to successfully do that. So I did want to just let you know that we are working behind the scenes on this partnership between the consortium, which is the Academic Consortium for Integrative Medicine and Health, and the ACIH on the development of a 36-hour hybrid course that addresses this very topic, right? It focuses on training students and practitioners of the integrative professions, as well as residents and last year students in medical school, to work together successfully in integrative and conventional medical in outpatient settings. It includes a training component in interprofessional education and clinical practice for all health professionals. It's 30 hours online, 6 hours in person. George Washington University is hosting the online portion. We are fundraising for this. We have a matching grant that is in. We have grant applications that are out. We will keep the community up to date on how this project is progressing. And here's a quick snapshot of our leadership team, which is a mix of consortium representatives, past and present, and also ACIH board members and friends, allies. So let me just check my time here. I'm going to give you, I have a couple more slides, and then we're going to go to questions. So this is a bit of an aside, but I did want to let you all know about this Alliance to Advance Comprehensive Integrated Pain Management. This is a new initiative funded by the Lovell Foundation and led by Amy Goldstein, formerly of the Academy of Integrative Pain Management. There's a URL there, that's their landing page. This is a new initiative. But the reason that I'm including info about AACIPM, and ACIH is pretty involved in this initiative. I have a role as sort of their integrative health sector coordinator through this grant with Lovell. And the reason that I'm sharing it is that pain management, and in particular comprehensive integrative pain management, is an evolving approach to the treatment of pain. Research in this space is nascent, it's building, and standards and competencies will be developed for this approach. Of course, CIPM includes the integrative professions as well as conventional approaches such as nerve injections, the controlled use of opioids and pain medications, and interventional pain management. So it's something to kind of take a look at. And what is the Alliance? AACIPM, it's a hub for multi-stakeholder, it's a hub which is a multi-stakeholder collaborative comprised of people living with pain, public and private insurers, government agencies, patient and caregiver advocates, researchers, et cetera, many, many stakeholders under the umbrella of this particular alliance. Let me check my time again. Okay, got a few more minutes. So we know that about 50 million Americans suffer from chronic pain, and AACIPM is focused on connecting the dots among these stakeholders for a paradigm shift in the treatment of chronic pain. I wanted to let you know some good news, which is why I have this link here about UVM Health. This is University of Vermont Health. It's an example of an early adopter of an insurance reimbursement model of integrative care for the treatment of chronic pain. And why is that important? Because CIPM includes not only conventional type of pain care, but also our type of pain care, right? The integrative therapies. It's a mix and a melding of the two in an evidence-based, evidence-informed perspective. And this screenshot here is from the University of Vermont Medical Center, in which they're showing these integrative therapies that are offered. So you might say, well, that's not so different than other integrative clinics that are out there and already offering this, but they are probably offering it through a concierge level of payment. The difference here is that this is one of the first early models of comprehensive integrative pain management with our types of integrative professions represented, that is going fully through an insurance reimbursement model. And it's very exciting because they're getting great results. So this could be a model for other university medical centers, which can tie us back to the Academic Collaborative for Integrative Medicine and Health, our partner in that hybrid course. So this pretty much rounds out my presentation. I did want to just close with a quote from one of the advisory committee members of this group, the Alliance to Advance Comprehensive Integrative Pain Management, Vanilla Singh, who is an interventional MD, who was until recently the Chief Medical Officer of Health and Human Services, HHS, and also was the task force chair of the Pain Management Task Force on Best Practices for the Treatment of Pain, that many of you, I'm sure, are familiar with. And she's now at Stanford. She says, quote, there is a no one-size-fits-all approach when treating and managing patients with painful conditions. Individuals who live with pain are suffering and need compassionate, individualized, and effective approaches to improving pain and clinical outcomes. This report is a roadmap, speaking of the task force report, that is desperately needed to treat our nation's pain crisis. So again, this is a space in which competencies and standards will eventually come to bear, and one that we will be watching closely, as I'm sure all of you are too, given the weight of the opioid epidemic and the and chronic pain and acute pain in our population. So this pretty much ends our presentation today. I thank you all for your attendance. Don't leave yet, because we do have some questions that have come through, and I'm turning it over to Deb Hill to go ahead and put those forward and have our panelists answer. Thank you so much. Deb?
Great, thanks so much, Alyssa. I do want to give a shout out to Sandy Fritz, who has her entire class watching today. So welcome, everyone. So we do have a question here. What healthcare-related accreditation entities recognize COMTA accreditation as ensuring massage therapists are competent and safe to work with those in a healthcare environment? So I'll leave that up to our panelists to figure out which one wants to field that question.
Deb, this is Dawn. Can you repeat that one more time?
Sure,
please?
yes. What healthcare-related accreditation entities recognize COMTA accreditation as ensuring massage therapists are competent and safe to work with those in a healthcare environment?
I think I'm getting hung up. Cliff or Dale, if you have any insights, healthcare-related accreditation or accrediting agencies. That was how you phrased it, right?
And I actually have a follow-up to that one, so it might help. Let's see. With that prior question about healthcare-related accreditation, I understand that COMTA is recognized by the U.S. Department of Education, but my understanding is that recognition doesn't necessarily align with what is needed and expected in the healthcare arena. Is there any effort to align COMTA accreditation recognized by those entities?
Well, I might be able to chime in if that's all right, Donna.
Yeah.
So COMTA is, I think the short answer is no. There are not, as far as I'm aware, there are not, like, for example, the Joint Commission is an accrediting agency for hospitals, and I suspect that they don't know who COMTA is. So they don't recognize us as the entity that is preparing students to, as the measurement of whether students are safe and competent to practice in that environment. Now, so COMTA is intended to be entry-level standards. So we don't have separate and distinct competencies that are, that speak to a hospital environment. Healthcare in general, I mean, there are some competencies in there that speak to that, but the competencies do not necessarily distinguish between, preparing graduates for a spa environment versus a healthcare environment. They're a little bit more entry-level general competence that graduates of those programs are safe and competent to practice. But I don't know if Don or Cliff, anything to add on that?
I guess the only thing that I would add is that accreditors don't accredit accreditors, I guess, if you will. It's right. I think you were spot on by saying that what we're talking about on COMTA accreditation is for entry level. I mean, COMTA is recognized by the United States Department of Education, and it is recognized by the Council for Higher Education of Accreditation. So I mean, we're everything that we're supposed to be, but you're right. The short answer is no. There is no specific group that would say we are the ones who would prepare someone to work in a hospital-based environment any more than we're the ones who would say that we could work in any environment. We're not saying that someone who comes out of a COMTA accredited school can work in a hospital setting or in a setting of an urgent care or in any specific setting.
I mean, it's. I might just add to that I think Dawn alluded to this in her introductory comments about COMTAs, or maybe Cliff, maybe it was you, that I mean, where we would like recognition, and we're working toward this, is at the state licensing level, and that's the most common place for education accreditors to be "quote unquote" recognized. Is in order to get licensed in any particular state, students would need to have graduated from a programmatically accredited school. That's not in place right now, but it is in place for just about every other healthcare profession. So that's certainly a goal of ours. That's something we think would be appropriate.
You're right on with that one.
I do have one more question here. I think that we'd wrap that up. And that is, do you think the lack of agreement on entry-level hours may hold a profession up in moving into more collaborative, integrative healthcare?
This is Dawn, and wow, that's a question that could probably take another webinar to explore. Would anyone like to take that?
Yeah, Stan here. I'd like to have an abbreviated answer. The answer is yes. I think it does hang us up. That's my personal opinion, not speaking on behalf of anyone but me. I think it would be better if we had a situation where there was a possibility for multiple tiers, one that addressed preparing for integrated environments, one for entry level. I think we're past time to do that. I think there's a number of folks like Sandy Fritz who have trainings that prepare people for both. And because she has an advanced program, she's also one of the first 6 certified educators in massage therapy and bodywork. So that's a little plug for her. That's my answer.
Okay. Deb, do you have anything that we can do in 30 seconds? We're very close to our time.
And now the time is up.
I think that's it. I want to thank all the presenters. It was really an interesting and deeply informative presentation by all of you. I know we could go into much more depth. I hope for our attendees that we've provided also interesting food for thought and resources for you to delve into through our handouts, all the information we shared on our slides, which are also going to be available after this presentation. So thank you again, and we are going to sign off now. Have a good day.
Thanks, everybody.
Thanks all. Bye-bye.